Assalamu alaikum. My name is Ali Hadi Ahmed. This presentation is for my graduation project, The Incidence of Mandibular Third Molar Impaction in Different Skeletal Facial Type, supervised by Dr. Arij Ahmed. Introduction. Impaction is the failure in tooth eruption, which can be a result of obstruction in the eruption path or inappropriate tooth position. Impaction of mandibular third molar. The impaction rate is higher for third molar than for any other teeth. The cause of third molar impaction has been suggested to be due to inadequate space in the retromolar area. Space deficiency at retromolar area is due to reduced amount of growth. Also, it can be related to the direction rotation of growth, which determines the type of face, mesophacial, brachyfacial, or dolichofacial. Mandibular third molar development. The mandibular third molar is an unusual tooth characterized by considerable variability in formation timing, variation in crown and root morphology, and not infrequently by agenesis. The third molar follicle first becomes apparent at age of 6 to 7 years and can be diagnosed by 8 to 9 years. At the age of 14 to 16 years, the third molar follicle is apparent in radiograph. If the follicle is not present at this age, agenesis should be considered. In analyzing the developmental course of the mandibular third molar tooth, a total of 9 stages of classification and movement were recognized. Mandibular third molar first show evidence of follicle formation during the 8th year on the average, but apical closure is not complete until the 20th year of life. And in substantial number of cases, the third molar tooth required even more than 12 years to complete its formation, often being still incomplete well after the time of legal majority. هاي الصورة راح توضح لنا الفورميشن stage of the mandibular third molar tooth. The incidence of mandibular third molar impaction. Third molar generally erupt between the age of 17 to 21 years. Third molar impaction is occurring in about 73 of young adults in Europe. It has also been reported that third molar eruption varies with races, such as in Nigeria, mandibular third molar may be erupted as age as 14 years, and in Europe it may be erupted to up age of 26 years. A few studies tried to determine if there are any gender variation in mandibular third molar impaction. Most of the researchers suggest that the female have a higher of incidence of mandibular third molar impaction when compared to the males. Causes of impaction. Impaction of mandibular third molar is commonly due to the lack of space in the dental arch in the area behind the second molar, and any pathological change either in the bone or the adjacent tooth bud can cause obstruction in the pathway of the eruption of the third molar. Many theories have been proposed on to hide incidence of mandibular third molar impaction. Bjork in 1968 proposed mandibular growth is related to resorption at its anterior surface and deposition at its posterior surface, but in case of disbalance of this process, the mandibular third molar don't get enough space to erupt. Richardson in 1975 proposed impaction of mandibular third molar can develop due to decrease in the angulation of mandible and increase in the angulation of mandibular bland. One of the most popular theories is insufficient development of the retromolar space. Proper mandibular third molar eruption also depends on the favorable path of eruption. For example, if the tooth bud is medially angulated, During the initial stage of calcification and root development, the path of eruption will be unfavorable. Yamaoka et al. In 1997 found the relation between the root angulation and impaction. Angulated roots were more common in impacted mandibular third molar as compared to erupted mandibular third molar. The most common causes of impaction of mandibular third molar are the abnormal position of the tooth pod, lack of space in the dental arch, supernumerary tooth ankylosis of deciduous or permanent tooth, non-resorbing bone due to the local or systemic cause. A provision of adequate space is associated with mandibular growth. In a previous study, it was demonstrated that premolar extractions had a positive influence on the developing mandibular third molar angulations. Mandibular space deficiency for third molar eruption demonstrated in three separator skeletal factors, which are short mandibular length, vertically directed condylar growth, backward directed eruption of dentition. This OBG show mandibular third molar partially erupted in contact with distal surface of second molar. Radiographical assessment is necessary to avoid the surgical extraction complication for the third molar. Radiographical diagnosis of third molar precede their surgical removal, and the most common complication in the extraction of third molar is nerve damage. The factors such as position of tooth, number and morphology of roots, and the relation between the root and mandibular canal require assessment of an atraumatic extraction of these impacted mandibular molars. Radiographical examination are either digital imaging or conventional. Digital imaging has many advantages versus conventional. A conventional radiograph examination may consist of panoramic and/or intraoral radiography. Panoramic radiography is a simple tomograph technique that introduces the panoramic view of maxillofacial region. Periapical radiographs are generally used to assess the impacted wisdom tooth, but it has a major limitation in the visibility of the jaw and associated structure like inferior alveolar canal. Due to this reason, the OBG is the radiographical of choice, essentially when multiple impactions are being assessed. This X-ray film shows radiographical evaluation of impacted mandibular third molar by intraoral periapical radiograph. Radiographical evaluation of impacted mandibular third molar by panoramic radiograph. The major disadvantage of both intraoral periapical radiograph and OBG. They provide two-dimensional information of tooth and its periapical structure. In cases where the mandibular canal and wisdom tooth are intimately placed, volume tomograph techniques such as CBCT or low-dose CT is indicated. Classification of mandibular third molar impaction. The classification by Bell and Gregory is widely used for predicting the difficulty of extraction impacted lower third molar. According to the relation of tooth to ramus of the mandible and second molar, Class 1 sufficient amount of space for accommodation of the mediodistal diameter of the crown of the third molar. Class 2 the space between the ramus and distal side of the second molar that is less than the mediodistal diameter of the third molar. Class 3 almost of the third molar is located within the ramus. According to the depth of the third molar in the bone. Position A. The highest portion of the third molar is on the level with or above the occlusal line. Position B. The highest portion of the tooth is below the occlusal plane but above the cervical line of the second molar. Position C. The highest portion of the tooth below the cervical line of the second molar teeth. This photo shows the Bell and Gregory classification according to the ramus of the mandible and according to the depth of the third molar in the bone. According to the nature of overlying tissue, soft tissue impaction, partially bony impaction, fully bony impaction. Another classification system, Winter classification, evaluated the impacted third molar long axis in relation to the second molar long axis. According to this classification system, a tooth can be mesioangular impacted. The rate of incidence is 43%. Vertical impacted, the rate of incidence is 38. Distoangular and horizontal, buccoangular and linguoangular impacted. This photo shows mesioangular impacted lower third molar, and this photo shows vertically impacted lower third molar. Skeletal facial type. Lack of retromolar space is due to an insufficient amount of mandibular growth. Additionally, it can be related to the direction or rotation of growth, which determine the type of face, mesiofacial or brachyfacial or dolichofacial. The facial skeleton grows in forward and downward direction under normal conditions. In mesiofacial growth pattern, there is a relative harmony in these two directions. The term brachyfacial is used to describe an individual with a short anterior face height and a wide face. Dolichofacial is the term used to describe a long anterior face height and a narrow face. Third molar impaction has been found to be related to some dental and skeletal features that are controversial and differing among varying populations. In 1991, Capelli claimed that third molar impaction was more likely to occur in vertically growing mandible. A long ascending ramus and short mandibular length seem to be indication of mandibular third molar impaction. Cephalometric radiograph assessment to the facial type. Cephalometric analysis is of great importance both for diagnosis and planning of orthodontic treatment. Measures related to the growth direction of the mandible, such as the mandibular angle, facial axis, facial depth, mandibular plane, mandibular arch height, and the anterior lower face, determine the third index, which cephalometrically distinguish three facial types. Brackets et al. In 1978 classified facial features into vertical facial pattern, brachy, mesio, and dolichofacial using lateral cephalometry. Studies that performed to evaluate the incidence of impacted mandibular third molar in relation to different facial types. In 2008, Brick and Grover find the overall rate of mandibular third molar impaction was 58.7%. Those with the brachyfacial type demonstrated an almost 2 times lower incidence of mandibular third molar impaction as compared to subjects with dolichofacial type. Bashir et al. Study in 2016. This study concluded that brachyfacial subjects over dolichofacial and mesofacial provide increased space for full eruption of mandibular third molar. Spacota et al. In 1918 showed higher rate of mandibular third molar impaction was found in dolichofacial type of face. So, decreased mandibular third molar impaction are seen in brachyfacial type compared to mesofacial and dolichofacial type. شكرا جزيلا.